Okay. Now, welcome to another discussion about antihypertensive drugs, and today's discussion is about the half-life of drugs. You see that in the management of hypertension is that you'll be having a difficult time to decide the type of drug to give because of pill burden. So in this case, you'll find yourself in a situation where you have to look for something which is long-acting drugs for treatment of hypertensive, and also because of the various comorbidities like diabetes, senile dementia, other conditions, hypertension, obesity, overweight, hyperlipidemia, all those type of things will come into play, and then at the end of the day, you have to give your patient a lot of drugs. In this case, you have to be able to select the drugs, and one of the criteria of selecting drugs in management of various diseases, including hypertension, is the half-life. So when you are selecting your drugs, you should select drugs which are going to stay in the body for a long time to prevent patients taking a lot of drugs to prevent pain burden. Now, in this case, now you look at various types of classes of drugs. You will see the four types of drugs in the management of hypertension and various half-life diseases. So you will start with the ARBs. These are drugs which works in the renin, angiotensin, and aldosterone system and inhibit it. And the good thing with this drug is that they don't have a side effect of cough, so they are safer than ACE inhibitors because they don't work on the bradykinin pathway. So in this case, you'll see that the drug like aziosatan is half-life is 11 hours, candestan is 9 hours, irbesartan is 15 hours, rosartan is 2 hours, omesartan is 13 hours, telmistatin is 24 hours, and the valsartan is 6 hours. So in this class, the best drug which can stay longer in the body is telmistatin if you have to prescribe drug in that class. Again, you remember that it is also compounded by the price. Also, some people can then be able to afford this type of drug. So on the other side, you have to prescribe AC inhibitors like benazapil, half-life is 11 hours, captopril is 1.9 hours, enalapril is 11 hours, usinopril is 12 hours, perindopril is 17 hours, and ramipril is 4 hours. So in this type of drug class, is that the best drug to prescribe, which has a long half-life, is perindopril, because at least you can give at least for 18 hours. These drugs works in the ACE inhibitors, but they have a side effect of dry cough, and also they have a side effect of maxoedema. So on the other side, we have diuretics, and the clothianidone is the drug which 40 hours half-life, so it can stay longer in the body, and the clothiazide is 5 and 14 hours, that is 25 and 50. 25 is 2.6 hours, and 50 is 14.8 hours. Then indapamide is 14 to 18 hours. So in this class type of drug, is clothianidone is the best drug prescribed because it is going to stay longer in the body for 40 hours. Now, when you come to beta blockers, we have atenolol, which has 7 hours. You have lisinopril, we have 12 hours. You have metopril, which has 7 hours. And also you have levodopa, which is 10 to 3 hours. 10.3 hours and that 1.9 hours. So the 5 milligrams is 10.3, the 10 milligrams is that 1.9. So in this type of class of drugs, is the best drug you have to give is Nebaron, which is Leviboro, which is having that 1.9 half-life hours. So you can give it as a whole dose. And now these drugs are good for beta blockers. They are very good in treatment of hypertensive conditions related with heart problems. So on the other side, we have calcium channel blockers. We have amlodipine, which is started to 55 hours. You have azidapine, which is 16 to 28 hours. You have benipine, which is 1 to 3 hours. You have credipine, which is 2.5 hours. Phenylpine, 11 to 17 hours, and the racidipine, 13 to 19 hours, and then with the nevidapine, 2 hours. So in this class, the best drug to prescribe is amlodipine. But you remember that when you're prescribing calcium channel blockers, your patients should always be checked for angioedema, or also they can get a rebound hypertension, or also sometimes they can get gingivitis. They can get gingivitis. So when you are treating hypertension, these are the type of few things you have to consider in terms of half-life of a drug you have to use. So with this few information, I think you'll be able to combine the drug and you'll be able to give your patient the best prescription in terms of hypertensive management. Thank you very much for this. Thank you.